This is Dr. Kavanaugh of Eye Associates of South Texas. I'm going to show you an Aril Amniotic Membrane Transplant on a patient with a recurrent corneal erosion. This is a patient who got an initial injury with a stick in her eye, obviously a sharp stick. You can see the epithelial defect here underneath the pupillary axis. And also on fluorescein staining, you see the small defect here with irregular edges and slight edema around the corneal defect. If we look here at a video of this, you can see the slit beam going across the clear cornea and see this epithelial defect that's round, approximately 1 to 2 millimeters, with irregular epithelial edges. And we're going to show you the cobalt blue filter picture of the defect and show this highlights the area where the epithelial covering is missing secondary to trauma. I'm going to show you the instrumentation needed for an Aril membrane transplantation. There's the Aril membrane in its foil sealed pack and an acuvue oasis contact lens and some Weck-cel spears. First, we dry the contact lens with the Weck-cel spears. We remove the amniotic membrane from its foil packaging. I find it better to cut the packaging rather than to peel it, and we place the amniotic membrane in the contact lens. This makes a ideal instrument just to place the contact lens on the corneal surface. You can see here the amniotic membrane on the epithelial defect, and also with fluorescein staining you can see it's well covered with the amniotic membrane and the bandage contact lens. Here's a video showing the Aril amniotic transplant on the clear cornea. You can see that it is clear. There are a few stria. They will disappear after the first few hours, and it is possible with the fluorescein staining to show the good placement of the amniotic membrane. We are going now to show you a slit lamp view of the clear amniotic membrane after 5 days and bandage contact lens placement. You can see the cornea appears smooth, the contact lens is in good position, the epithelial defect is completely closed. We can see on fluorescein staining underneath the contact lens, and there is absolutely no evidence of an epithelial defect. I remove the contact lens with a jeweler's forceps. I place it underneath the bandage contact lens, and once I lift up an edge, I will peel the contact lens off. I find this is less traumatic than removing the contact lens just with my fingers. And you can see here with fluorescein staining, again, absolutely no evidence of an epithelial defect. It's healed well. And in a recurrent corneal erosion, we know it is important now to lubricate the cornea with artificial tears 4 times a day and ointment at night for at least a month to prevent recurrence of this recurrent corneal erosion. I will show you some color photographs of the cornea. You can see here in the exact area of the defect, there's no evidence of it anymore, as well as with fluorescein staining. No evidence of an epithelial defect, and this recurrent corneal erosion will do well if treated with lubrication. Thank you for your attention. This is Dr. Kavanaugh of Eye Associates of South Texas.